Good morning. My name is Thazhekode Gopinathan. Today I'm going to present about special topic individual report. The purpose of this special topic is to find out managerial implication of findings of independent scholarly project. Title of my independent scholarly project is Conceptualizing and Measuring the Effectiveness of Diabetes Self-Management Education on Glycemic Control in Diabetes mellitus. The presentation is brief description about application of findings and managerial aspect from individual hypothesis in the New Zealand organization. The first hypothesis is diabetes self-management education positively affect the glycemic control. The managerial interpretation is the complications connected with the diabetes mellitus can be prevented and the quality of life can be improved through the diabetes self-management education. Diabetes self-management education is inevitable for all diabetes patients without consideration of age, but DSME for all people is complex because the care assistant, multidisciplines, and the personalized care plan has to be involved due to complications of caring of the old patient. In this scenario, I took SME as an area park retirement village. It is locating in Epsom, Auckland. The management of the area park may proceed with a rigorous training program, which can be prolonged for a few weeks to improve the quality of life of diabetes inmates. Additionally, the manager of retirement home has to consider individual diabetes-related knowledge, nutritional assessment, physical activity assessment, depression, and physical disability for executing DSME. Moreover, the other factors like life expectancy, quality of life of individual patient, and the cost-benefit factors also important in the decision-making process for the glycemic control among the diabetes patient in the retirement village. Moreover, the management of the retirement home can have their influential role in diabetes self-care behaviors like healthy eating, monitoring, being active, taking medication, problem solving, reducing risk, and healthy coping with stressful conditions through the managerial intervention and by creating facilities. Lastly, the retirement home management also should give importance to the culture of individual diabetes patient. The second hypothesis is diabetes mellitus self-care activities can have positive impact on glycemic control. The managerial interpretation is the health issues related to the diabetes mellitus and glycemic level can be regulated through the self-care activities. This brings positive aspect in the life quality of diabetes patient. In this scenario, I took SME as a Greenland Clinical Center, which is working under Auckland DHP. The management of institution like a Greenland Clinical Center may take an effective step for the creation of awareness and adherence to the self-care activities, which include food care and cessation of smoking among diabetes patients. Additionally, the management can formulate separate education program for different diabetes patients. Lastly, the negotiation and fixation of glycemic level with the individual patient by the Greenland management and the use of mobile application in diabetes self-management education can bring better output in glycemic control. The third hypothesis is sufficient knowledge about diabetes mellitus will reduce glycemic level. The glycemic level among diabetes patients can be effectively reduced through the satisfactory knowledge about diabetes mellitus. In this scenario, I took an SME as a North Shore hospital. So the management of the North Shore hospital can plan for diabetes education for reduce the complexities and better standard of life of diabetes patient. Moreover, management can plan for separate education program for both genders. In addition to that, diabetic knowledge that patient can be educated their health status for better result. The fourth hypothesis is there is a relationship between glycemic control and demographic variable. The managerial interpretation is the demographic variable like age and ethnicity is influencing factor in the regulation of glycemic level. So in this scenario, I took an SME as a diabetes in New Zealand. So the holistic approaches after the consideration of the external environment, demographic variable and knowledge of diabetes patient can bring more effectiveness in the managerial decision of diabetes New Zealand. So the conclusion is the diabetes self-management education has a positive effect in the glycemic control of diabetes mellitus. Moreover, the appropriate managerial decision in the health-related topic is reached by synchronizing the knowledge in the health and business. Thank you.